Now I would like to involve Dr. Lale for her second presentation about chronic inflammation in ozone.
Yeah, बिल्कुल. Okay.
Welcome again. Well, inflammation is the other problem that we are fighting with as a clinicians. Inflammation is all over in our body. Generally, it's because of the nutritions that we are eating in our century. And actually, this is Hagia Sophia from Istanbul. And this is the Bosphorus view from my homeland. And inflammation, we are fighting with inflammation, but sometimes inflammation is good for us. So we have to recognize a fine line between the harmful and useful inflammation. And this is the cover of the Science journal in 2013, and there is an alveolar macrophage of a mouse, and here is a fine line like the yin-yang, the bad inflammation and good inflammation. They wanted to point it out. And as soon as we get our first breath, as I mentioned before, oxygen is the most oxidative stressor in our body, and it causes superoxide radical, hydrogen peroxide, and OH radical, and inflammation starts immediately. And these pro-inflammatory factors, when it comes to our body, if our immune system works good, the biological response is good, then the repair mechanism starts and we do not have any inflammation. But if it's not working good, then the Th2, T helper 2 cells start to dominate T helper 1, and then the interleukin, the inflammatory cytokines, NO and superoxide radicals starts to be secreted, and these are also suppressing the T helper 1 cells. With ozone, what can we do with ozone? Can we inhibit the pro-inflammatory targets? Can we boost the anti-inflammatory targets, or can we reprogram the immune cells? Again, in our blood, when we get these radicals, free radicals, the superoxide dismutase, the antioxidant, one of the most used antioxidants in the plasma, the superoxide dismutase changes superoxide to hydrogen peroxide. And hydrogen peroxide is changed to water by catalase. And it goes also inside the cell. But the most and the worst radical is the hydroxy radical, and this is damaging our DNA actually. And the glutathione system inside the cell is fighting with this hydroxy radical. As I showed in the previous lecture, the mitochondrial dysfunction is started. It's caused. These are the cause of mitochondrial dysfunction actually. So the damage starts with these radicals. If we have these radicals raised in our body, in our blood, then the superoxide dismutase catalase is less in quantity. And with ozone, we are inside the cell, we are regulating the antioxidants actually with these oxidized glutathione and doing immune modulation with the reduced glutathione. So there is a balance. We are making the imbalanced equilibrium. We are taking it into equilibrium. Actually, the imbalance. The oxidative stress markers in the inflammation are high. The malondialdehyde, the superoxide radicals, and hydrogen peroxide. And when we do ozone therapy, we can measure the decrease of these oxidative stress markers. And in the you can measure the upregulation of these antioxidant markers with ozone therapy. See, the superoxide dismutase, as I said before, it is changing the superoxide radical into hydrogen peroxide, and hydrogen peroxide had been metabolized by catalase into water, and these the hydrogen peroxide inside the cell and the OH radicals are processed inside the cell to hydrogen to water and OH radical again. So the superoxide dismutase, catalase, and glutathione system are working all in together, and ozone is upregulating these antioxidant systems. And for example, in the diabetic patients and burn patients who have high superoxide dismutase levels, they recover faster. And the patients who have less superoxide dismutase levels, they recover slower than the other ones. And catalase in the plasma breaks hydrogen peroxide into water and oxygen. And glutathione is the most important antioxidant system inside the cell, and we are upregulating this antioxidant system with ozone. So let's see here. Can we reprogram the immune cells? With the inflammation, the T helper 2 cells are secreting these inflammatory cytokines, and these are suppressing the T helper 1s. So the inflammation starts and goes up. But in 1990s, Dr. Bocci has shown that with ozone therapy, we can increase the gamma interferon inside the cell. And this gamma interferon is secreted by Th1 cells, and this makes a suppression to T helper 2 cells. So they cannot secrete these inflammatory cytokines, suppressive cytokines, so that we can do a reprogramming. Here is a model of rheumatoid arthritis, an animal model. This study has been done by Olga Leon in 2013. They have looked to the total arthritis index of the mouse. they have given, there's a control group here at the bottom, and the red line is the rheumatoid arthritis group, and the yellow one is the rheumatoid arthritis group plus oxygen, and the blue one is the rheumatoid arthritis plus the ozone group. They have given intra-articular ozone 3 times a week for 3.5 to 3.5 weeks, and then they measured the total arthritis index of these rats. And then at the 10th day, they started to give ozone and they started to give oxygen to the groups. At the end of the study, you can see the control group is here at the bottom, here, and this is the blue one is the ozone group. It's lower than the rheumatoid arthritis, the red line. See, it's significantly low. And the yellow one is the oxygen group. It's greater than the actually rheumatoid arthritis group. So ozone is effective in the total arthritis index in the animal model. And in this study, they also measured the ankle thickness of the rats. And the same, they've given in the 10th day, they have done the rheumatoid arthritis, and they've given the 10th day ozone and oxygen. You can see in here the bottom, the white line is the control group, the red line is the rheumatoid arthritis group, and the yellow is the oxygen, and the blue one is the ozone group. At the end of the study, you can see that ozone and the control groups are similar. In rheumatoid arthritis, there are histological results also. You can see here in the A photograph, it's the normal morphology of the synovia actually. In B, you can see the proliferation of angioblasts and new capillaries and the invasion of leukocytes. This is the rheumatoid arthritis group. And in the C, you can see that the synovial thickness is almost normal in ozone group. And in D, it's the oxygen group. You can see the thickness of the, I cannot show it. You can see the thickness of the synovia here. It's very thick when you compare with the ozone group, and this is the normal. Ozone looks like the normal group. Can you change the battery of this pointer, please? It's very difficult. Okay, thank you. See, this is the normal, and this is the ozone group, and this is the oxygen group. Oxygen makes harmful inflammation in the tissue actually, and ozone group is similar as the normal group, control group. And here in rheumatoid arthritis rat spleen, they have measured the superoxide dismutase. This is the control group. In rheumatoid arthritis group, you can see the low antioxidant level, superoxide dismutase, and this is the rheumatoid arthritis group plus the ozone group, so you can see the increased measurement of super antioxidant system, and this is the oxygen group. And here there is nitric oxide. This is the control group, and the oxidant in rheumatoid arthritis group, and this is rheumatoid arthritis plus ozone. See, it's lower than the control group, and this is the oxygen. Here, this is the TNF alpha in rheumatoid arthritis, rat spleen they measured, and it is almost the same as the control group in ozone group. And in a patient clinical study in rheumatoid arthritis patients, they have done 20 rectal ozone insufflation, and they measured the superoxide dismutase, catalase, and glutathione. As you have asked, how can we measure? Can we measure it? Yes, we can measure it. This is the control group. This is the ozone group after 20 rectal insufflation. This is the catalase as antioxidant, and this is in the beginning, and this is after 20 rectal insufflation, and this is the glutathione we have measured. It increased before when you compare before and after. And this is the oxidative stress markers with rheumatoid arthritis patients. After 20 rectal insufflation, you can see the decrease of the malondialdehyde and total hydroperoxides and nitric oxides. And here there is a disease activity score. They have given standard rheumatoid arthritis therapy to these patients, and they added medical ozone to their standard therapy. After 20 rectal insufflation, they measured the disease activity score, and you see the decrease of the activity score. And in standard therapy, there is almost no change. And there is a disability health assessment questionnaire. Also in this, with the ozone, medical ozone, you can see the decrease of the questionnaire. Here are the cytokines. You know, you have to integrate your ozone therapy into classical therapy methods. It should be an integrative therapy. So in rheumatoid arthritis, we are using diclofenac, we are using methotrexate, Enbrel, and so on. So when we add ozone therapy to this, we have more achievements. So the quality life of the patient is increased. And if we do ozone therapy in cycles, you know, we are doing 10 treatments, and then 3 months later another 10 treatments, then the cellular glutathione level is increasing more than the beginning. And here is a book of Dr. Renate Viban and Olga Leon. In English, it's published in 2020. It's a very good book about the mechanism of action and about the dosages, combinations, and so on. So you can get this if you like. And thank you for your attention. Yes.
Dr. Lale, Faisal from Indonesia. In your slide, I oftenly found the word SOD, superoxide dismutation. It's an enzyme, am I right?
Antioxidant.
Antioxidant.
Antioxidants, yes.
Also GSH, glutathione.
Mm-hmm.
Yeah.
And catalase.
Yes. We also already familiar with in the field of anti-aging, using also glutathione. Yeah, that infusing to the patient. Yeah. Do we need also combining ozone such as major autohemotherapy or rectal ozone insufflation with the outside intake from glutathione, such as from Italy, such as Tationil, something like that? Because in my country, we are using a lot of that.
It's very popular.
Yes.
And it's a miracle of advertisement, I think, glutathione, because it's a very potent molecule, and you see it's intracellular here, and we are increasing with ozone the intracellular glutathione via the hydrogen peroxide. But the one that we are giving IV, glutathione, it does not even reach to the cell. It's a miracle of advertisement. It doesn't work very much for anti-aging. If you do ozone therapy to your patients, you can increase the intracellular glutathione, the antioxidant system. If the patient insists on getting
Yes.
glutathione, because our patients, they come with their prescription. Oh, doctor, I want 5 sessions of glutathione.
Yes.
They come like this. And then I said, okay, but first we do ozone therapy to you and increase your intracellular glutathione. And then, if you like, we can add it. I cannot say if you have so much money, we can add it. I say, okay, if you like, we can do it. If they want, then I add it, but it doesn't affect as much as ozone therapy because it's intracellular, and the one that we give, it
outside?
doesn't even complete a circle.
Oh.
It's gone.
What about like a high dose vitamin?
Vitamin
also
C, yes, we
using
can. It's soluble, and it's soluble in the plasma. So you can use it, but it stays a little bit in the blood. Actually, it's excreted via the kidneys, but it stays a little bit inside. Glutathione doesn't even stay because it's react with the other plasma and so on. It's gone.
So in other words, you said that because we're talking inflammation and before you're talking diabetes, so in those two terminology of disease, you said that ozone alone is enough.
Ozone is
I mean for the
for glutathione inside the
yes.
cell. Yes, ozone is enough, but if they want, you can give. You don't harm actually
okay.
with giving glutathione.
Okay, thank you.
You're welcome. Okay, thank you.